Bobby, as you know, I don't agree with you on vaccines because we've talked about it before. And so help me understand this. So if you say to me, hey, listen, Big Pharma is lying about X, Y, or Z, that doesn't seem inconceivable to me at all. Big Pharma, I can't stand them for a number of reasons, for all the reasons that you sued them in the past and the damage that they've caused in different cases, for the fact that they're preventing us from negotiating drug prices. So I'm not convinced by mainstream media or the lobbyists, et cetera. But when I go to talk to about the COVID vaccine, every doctor I know, every scientist I know, they say the entire medical community and themselves say that it does work and that you're wrong about it. So do you see, Bobby, why it seems like you're asking a lot of people by saying, no, believe me, instead of what appears to be the entire medical community?
Yeah, first of all, I bet you if you and I talked about vaccines and actually looked at data, you would agree with me on almost everything. But let me just, before I answer that question, let me basically outline how I stand on vaccines. Vaccines, no vaccine is safe and effective for everyone. There are certain numbers of people, the Supreme Court said, vaccines are unavoidably unsafe. That's when they upheld the immunity from liability. They said unavoidably unsafe. You cannot make them completely safe for everybody. So, and if you look at the list on a manufacturer's inserts, there's 420 injuries that are listed on the manufacturer's inserts from vaccines. My concern is the people who get injured. And I think, and the medical community's reaction to those people is that we shouldn't talk about them because it will sow doubt about vaccines if you even admit anybody's getting injured. The vaccine courts have paid out billions of dollars in injuries, so the injury is real, it's undeniable, and it's on the manufacturer's insert of every vaccine, and they're very serious injuries, including death. Whether they're rare or not, I think we should be able to talk about them. There are kids with rare cancers, and we talk about them. And if somebody has a vaccine injury, we ought to be able to, and the scientists and doctors who are treating them ought to be given a fair hearing. And that's really where I come down. I think we should have good science, and we all should have informed consent, which means everybody knows we have really good science that tells us what all the answers about efficacy and safety. Everybody knows what the side effects are, and you can make an informed choice about it, and we shouldn't be mandating them to people. That's really, if you love your vaccines, I'm not going to take them away from you. I'm just going to give you good science, and I'm going to try to make them as safe as possible. Now, you pointed out the pharmaceutical industry is not a trustworthy industry. It's a criminal cartel, and I don't say that lightly. The 4 companies that make all of the vaccines, the 72 vaccines now mandated for our children, all of them in their other products have paid, I think, $79 billion in criminal penalties. They haven't paid anything with vaccines because vaccines are immune from liability. So you cannot, no matter how negligent that company is, no matter how reckless they are, no matter how grievous your injury, you can't sue them. And you know and I know that if you tell a company that we can sue you if you do something wrong, they're going to be more careful about it.
Yeah.
And if you tell, these are companies that have been showing, for example, Vioxx. Merck knew that Vioxx caused heart attacks, but it didn't tell its customers. It marketed as a headache pill and an arthritis pill. And so the customers went and took it, and maybe hundreds of thousands of people died as a result. Many of those people would have said, if they knew that it could kill them, they would have said, I'll take an aspirin instead. But they weren't told that. And Merck did that deliberately. They ended up paying about $7 billion in the end, but they still made money on the product. So what if you could tell Merck, here's a product you'll never have to, no matter what happens, no matter how sloppy you are, no matter how reckless, no matter how toxic the ingredient, you'll never have to pay anybody any downstream liability. On your, you can bet that they're not they're probably not going to behave if you waive all liability. So that's something we should be concerned about. But as president, what I would do is I would get rid of that immunity. I would lift the immunity and make them accountable and make them responsible, because that's the only way to ensure the safety of this product. I would say this about the COVID vaccine. You remember at the beginning of COVID, we were told that if you take that vaccine, because you just said, oh, the medical community all says it works. Well, what does that mean? Because originally they told us it would stop transmission, and that if you
Not
got
really. No, they didn't.
No, but check. You can go on. There's whole reels out there on YouTube that your listeners can go to right now with Tony Fauci saying, if you get this, you cannot spread it to grandma. You cannot spread it to anybody in your family. You are protecting other people by getting this. Well, that's because we were told that it would prevent transmission. Otherwise, how it's going to protect other people? We were guilted into it. We were shamed into it, because they said it stops transmission dead.
Right.
And they all said this. Bill Gates said it. Tony Fauci said it. Elizabeth Burke said it. Robert Redfield said it. Joe Biden said it. They have them on tape again and again and again.
Everyone who takes the vaccine is not just protecting themselves, but reducing their transmission.
Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick.
We have all the vaccines we need. We just need our people to take it. A, for their own protection, for the protection of their family, but also to break the chain of transmission. You want to be a dead end to the virus. So when the virus gets to you, you stop it. You don't allow it to use you as the stepping stone to the next person.
You're not going to get COVID if you have these vaccinations.
Now we know that the vaccines work well enough that the virus stops with every vaccinated person. A vaccinated person gets exposed to the virus does not infect them. The virus cannot then use that person to go anywhere else.
That wasn't true, and they knew it wasn't true at the time. And I was saying at the time, it can't prevent transmission. Why was I saying that? Because I was actually reading the science. In May of 2020, I read the monkey studies, and the monkey studies showed that the animals that were vaccinated were getting levels of concentrations of SARS-CoV-2 in their nasopharynx that were equivalent to the unvaccinated. So it was clear then to anybody who looked at those studies that it was not going to prevent transmission or infection. So I would say, and if you look, and then I'll just say one other thing. All around the world, there are countries that were heavily vaccinated, and there are countries that were essentially unvaccinated. And I'm not saying this is a correlation. It does not prove causation. But for example, our country, which was one of the most heavily vaccinated in the world, had the highest body count from COVID of any nation on earth. So we lost 16% of the American people. We had 16% of the COVID deaths in this country. We only have 4.2% of the world's population. So we literally did worse than any nation on earth. Now, we were told at the beginning by Anthony Fauci and Bill Gates, et cetera, that the nations that were going to get wiped out were the nations that couldn't afford the vaccine, specifically Haiti and Nigeria. Haiti had a 1.3% vaccination rate, and the death rate from COVID was 14 people per million population. Our death rate, American blacks, 3,000 per million population. In Nigeria,
right, but
1.4. Now, that doesn't mean the vaccine had anything to do with it. But what it means is it's something we should be studying.
But Bobby, look, let me just jump in. So number one, if you say, hey, let's study it, of course. I don't think any rational. No, but I don't think that's all you're saying, though. Hold on. So I think almost all rational people, including scientists and doctors, certainly say study it, of course, right? If you say, hey, the medical community said some things that were wrong at different times, like for example, Dr. Fauci said you don't need to wear masks in the beginning. Then later they changed it to you do have to wear masks. You lose faith with people when you do that. But it's relatively easy for someone like us that care about the news to suss out those things. I said that doesn't make any sense when they said, oh, a virus broke out right next to a virology lab, but it didn't come from the lab. That doesn't make sense. But at the same time, when I'm not the expert on it, you say that you are an expert on it, I can't debate you like on every single thing on Nigeria. So I do know there's a ton of factors. It might depend on the density of the population as opposed to the vaccine.
And the age of the population.
Right, and then you see countries like Sweden that gave up on their experiment of not sequestering people, right? So they were out and open, and then their COVID rate was out of control, and they had to bring people back in.
They ended up having the lowest COVID rate in Europe.
So there's a lot of data, et cetera, right?
Yeah.
So, but sometimes you do have to make things mandatory. I'm not saying every time, right? And that's a tough judgment call. So for example, on some vaccines, polio, smallpox, others, you might have to make it mandatory. George Washington made it mandatory for his army. He lost a third of his army, but won the war. And if he hadn't done that, if he hadn't made it mandatory, we're probably still living under England right now. So there are some circumstances where mandatory does make sense. So the main question is, for people who like your other policies, if the scientists and the doctors come in and say, Bobby, this one has to be mandatory. Here's the reasons why, here's all the data, et cetera. Are you going to listen to them?
Listen, under some extreme circumstance, I may look at that and say this is so obvious, but the problem is you have a medical cartel that is tied inextricably to the pharmaceutical industry and is more concerned with promoting the mercantile interests of the pharmaceutical companies than in public health, and they've shown that again and again and again. So listen, if you have a product that clearly works and there's a disease with a high infection rate, people are going to line up to take that product. I would leave it to the individual. I wouldn't say that that the government should ever be mandating a medical product to that you're going to do to your body. And we all agreed that after World War II, with the we signed the Nuremberg Code. There were trials just for doctors. At the end, they were called the doctor trials at Nuremberg, because the medical community was so badly behaved in the Third Reich.
But you don't think that's what's happening with doctors in America? I mean, how is every doctor I know saying you're wrong? You think they're all wrong?
Well, first of all, there's, I think, 76,000 doctors have signed a petition essentially supporting my position. So it's not every doctor.
Okay, not every, that's fair, but definitely a very small minority of doctors.
Well, yeah, but the question is are the doctors, do they hold that opinion because they're reading a scientific study, or do they hold that opinion because the CDC told them this product works? And that, that's what I would ask the doctor. I'd say to him, show me the study that you're basing that opinion on. Because I read science, that's what I do for a living. I read science for a living. I've tried something like 500 cases. Almost all of them involve scientific controversies. And my job is to deconstruct science and and cross-examine and direct examine witnesses and find out whether they really are basing their opinion on something that is factual and is solid. So, and I think a lot of times doctors and the medical profession, they're so busy, they're not actually going out and reading the science. They're taking the word of CDC. This works, this product works. You should be recommending it. The AAP, the American Association of Pediatrics, makes these recommendations and establishes medical care protocols, but they get about 80% of their money from pharmaceutical companies. So don't we have to be worried, and shouldn't we be worried that those decisions are influenced by the money that they're getting, by these conflicts of interest?
Well, I do worry about it. I worried about it in the OxyContin context. And so that's why I've got the credibility to be able to say, like, I see when they're doing wrong, but at the same time, I see when they're doing right.
Cenk, you know what? This is a really, really good example that you just brought up. OxyContin. Every doctor in America was prescribing OxyContin and telling their patients it's not addictive. Why? Because FDA lied. It colluded with Purdue and the other pharmaceutical companies to lie to the American public to make billions.
Example, because you're right about that, and it wasn't every doctor, but it was too many doctors. And then they set up junkets to get the doctors to Vegas and have a good time,
and the vaccine companies do the exact same thing.
No, I hear you on that, brother. But what happened with Oxy was eventually the doctors said, no, this isn't right.
No.
This isn't right.
What happened is there was litigation. And the litigation woke the doctors up.
I'm in favor of the litigation.
Right,
I'm in favor of all the work that you've done in the past on that front.
Right, but
the doctors now do say, oh, it's definitely addictive. But they've never said that about the vaccines that you complain about. And it's not just COVID, goes back 20 years.
Cenk, this is what I'm saying. They changed their mind because of the litigation. All the discovery that came about because of that became public because of that litigation. What if you could never sue those companies? The doctors would still be writing those prescriptions. With vaccines, you cannot sue them. So they can keep all those documents secret. So imagine it's the same companies, it's the exact same companies, but with vaccines, they cannot be sued.
Yeah, I think that there's a way to thread the needle where you could do a lawsuit maybe after some period of emergency has passed, et cetera.
You can't. Believe me.
I know we can't today.
But there's hundreds and hundreds of lawyers that have been trying to figure this out that have injured clients. And you cannot sue these companies.
Right.